And good afternoon, good morning, good evening, whatever the time may be when you may be watching this. Thank you for stopping by to listen to what I have to where this episode of talking about the Congo. And our topic today is water in healthcare facilities. So before we get started, come on in, have a seat, take your uh, get relaxed and participate in the discussion here. And also, if you like this, please subscribe, like it, and share. So we're going to go ahead and get started about talking about Congo, and our topic for today is, as I said, water in healthcare facilities. And I guess the big thing is another topic that been thinking about the people in Texas who had a real big problem with electricity and water, as I talked about it yesterday. And today I'm talking specifically about in healthcare facilities because I know that there was a number of hospitals that turned away patients because they didn't have water or electricity. They also evacuated some hospitals because they didn't have water or electricity, and was in the middle of the pandemic, so that just made things even worse. So I thought about from the electricity and water standpoint of in our health facilities over in the Congo, and I decided to talk about the water because I read this article that talked about one of the facilities in Austin, Texas, on how they were saving water, how they were trying to make do with little water they had. They did some of the same things that we do in the Congo. They collected rainwater. That's one of the big projects that we do in the Congo is use rainwater to provide water. Uh, so whenever it rains, they do catch rainwater. And we've outfitted a number of the facilities there with these cisterns connected to the roof that collects the rainwater. Not all the facilities have this, but that's the new standard that we're hoping uh, to embrace. That we get every hospital or healthcare facility have some type of rainwater catchment system. Also, they was uh, had to come up with some way not to waste water. And one of the things that we have always in the developing countries said a lot of people had adopted the way that we do things here in the United States, where we use clean, drinkable water to use for flushing our toilets. And that's one of the things that I'm glad these people realize is, when you have no water or you limited supply of water, you need to make alternate plans to get rid of uh, our bodily fecal materials and other uh, materials that our bodies shed that we have to get rid of. In the Congo, we don't use water for toilets. We use pit latrines there, where they you defecate, urinate directly into a pit, and the that goes into the ground, and then eventually you know you, you may have to clean it out. After several years, actually move to another one. In some areas, they use a composting latrine where you can actually take the material out once it's been in there and it's all the germs and bacteria have died off in it, it makes good fertilizer. And also the urine also makes good fertilizer because it's high in nitrogen that is good for leafy uh, uh, vegetables and things like that. So in the Congo, they had to do things differently in Austin, but in the Congo, that's something that we do, and that they don't have water to waste in the first place, so therefore they're using alternate methods um, for sanitation purposes. And finally, hygiene. Uh, yeah, that's one of the big things that people in the Congo have problems with is the hygiene. Basically, washing yourself, wash the bodies, or whatever the case may be. They don't have water to do that, and what it does, you see high infection rates, especially after a person has a cut or a surgery or something like that. Is there's a high infection rate because their hands are not as clean as possible, and even when they come in to do change of dressing, uh, they don't have the water to adequately cleanse themselves or cleanse their bodies or these wounds. You develop a infection on it. So not only uh, you have that problem, but it also creates a deadly combination of when you have a high infection rate and stuff like that. So that's kind of what happens in the Congo. But I thought about what the nurses and health staff here in Texas was doing, and it just reminded me of, they don't have water and electricity in the Congo every day, and they have to deal with that. And it was so graphic that we had to hear about situations here in the United States that was dealing with that. So we will continue to work with our brothers and sisters in the Congo and try to get them water, because water is essential to in a health facility that is needed. So thank you all for coming by, and if you have any comments on that, please drop them in your chat, whichever platform you happen to be on, and we can get you an answer. Take care of yourself, and we will see you tomorrow. Remember to wash your hands and wear your mask so that we can get this pandemic under control. Thank you again, and we will see you tomorrow at 3 o'clock again for another episode of Talking About Congo.